Can persistent symptoms flare up after resolving, i.e. getting sick or major life stresses? This is something I hear all the time. People are like, well, I can't do that because that will really flare me up. Flare me up with the air quotations. There's going to be stuff that provokes your symptoms throughout recovery. But again, concussion stops being a concussion very soon after the injury occurs. So what we know of concussion is that it's this acceleration-deceleration injury. It creates some microstructural damage potentially within the axons, but it creates this temporary drop in ATP energy levels within the brain that does recover over that kind of 3 to 6 week period. Beyond that 3 to 6 week period, everyone's looking for the reason or the brain-specific reasons of why people have persistent symptoms. And we haven't really landed on anything that's really all that conclusive. We've landed on things, like I said, blood flow impairments potentially. Well, there's treatment for that. We've landed on things like potentially metabolic inflammatory issues. We've landed on things like neck dysfunctions, visual and vestibular disturbances, and things like that. So, can persistent symptoms flare up after resolving? Yes, your symptoms can flare up after resolving, but I think people need to start making the distinction between my concussion has flared up versus my vestibular problem has flared up. And I need to go and work on my vestibular function and do some more rehab and do some more exercises to get that under control, right? The symptoms may have started with concussion, but after about a month or so, the symptoms are no longer concussion anymore. Now you're into the PCS, which is really, it's tough for us to find a brain-specific mechanism. So I don't think we should attribute ongoing flare-ups to brain injury or ongoing brain injury. I think what it should be attributed to is you have a flare-up of symptoms for whatever reason, whether or not your vestibular system was also impacted as a result of the injury, and now you're having a flare-up of your vestibular system because you feel a little bit dizzy. Or maybe you had a neck injury that happened at the same time as your concussion, and that neck dysfunction, that neck injury can cause the same symptoms as concussion. For example, headaches, dizziness, confusion, visual disturbances, ocular motor tracking issues. All of that stuff can be due to a neck injury. So, can your symptoms flare up after resolving? Yes. But are they due to concussion or are they due to something else? I think we have to have the mindset that this is due to something else, and I think that'll help you to get over things a little bit quicker, because people avoid activity because it flares their symptoms. In concussion, a lot of healthcare professionals that are kind of old school, that haven't caught up to the literature, learn that anything that provokes your symptoms should be avoided. And actually what we're finding now is that anything that provokes your symptoms should be done more often and more frequently. It's habituation and adaptation. You want to do things that bother you so that they don't bother you anymore. That's the basis of what concussion rehab is a lot of times. It's, when I do that, it makes me really dizzy. Great. Let's do that repetitively until it doesn't make you dizzy anymore, right? It would be like training for a marathon or training for, let's say, weightlifting, right? If I got injured, I would stop lifting weights for a period of time because I was injured. And then I would try to go back to doing weights. But a lot of times with concussion, people try to jump into what they were doing, 6 months ago. And they're not there yet. You're out of shape. If that's how you want to think about it, you're out of shape, right? I just had a baby 2 months ago. Well, I didn't have the baby. My wife had the baby. But 2 months ago, had a baby. Haven't been to the gym in 2 months. Last week, I went and did a chest workout. Not only was I lifting 30% less than what I could bench press before this, I was so beat up and sore for the next 3 days that, you know what? If I was a concussion patient and I did something that flared my symptoms, or if I'm somebody who hasn't worked out in a while and I do something that causes me pain, is the answer to stop lifting weights because it made me sore afterwards? No. The answer is to continue lifting weights so that they don't make me sore anymore. The only reason I'm sore is because I'm out of shape. And that's the same thing when it comes to concussion symptoms. So your symptoms can get flared up, but what people need to realize is that you should not be afraid of your symptoms. It's hurt versus harm. You're not harming yourself. You may hurt yourself a little bit. It may hurt. It may be painful. It may be tough. But don't avoid symptoms. These flare-ups are not due to concussion. These flare-ups are due to flaring up the ongoing dysfunctions that you may have. And this is not permanent. So don't avoid things because it makes you feel a little bit worse for a period of time. Because anytime these flare up, people are worried that it's going to go on forever, and it's not. If you have a good healthcare professional, somebody who's trained in this area, when their symptoms flare up, they come in and see me and I go, oh, here's what it is. It's just this. I want you to do this and you can get over it. But if you do something that scares you because it causes symptoms, what you need to know is that this is not a permanent thing. This is not impairing you. This is not making you worse. This is not setting you back. This is not making you spiral down out of control. It's very, 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 very temporary. But sometimes it's the other things, the anxiety that goes with that makes you feel the symptoms for a lot longer than what they should actually be there for. And again, this is why having a really good, solid, trained healthcare professional that knows about concussion, that can ease your mind on this stuff and help to kind of get you over that, will help you from that psychological standpoint, but as well as the physical standpoint. So a bit of a long-winded answer on that one. But anyway.